Morning, everyone. Welcome to one more lecture of neurology, and today our lecture is about infections of CNS, central nervous system. So, if we will talk about, um, you can say, the classification of CNS infections. So there are many. So broadly, we can classify them as bacterial infections, viral infections, fungal infections, protozoal infections, okay, as well as um, what you can say. Sometimes, after infections, what happens is there is some sort of damage to the CNS, but like they are not infections, for example, or you can say like indirect infections. For example, Guillain-Barré syndrome. In that one, like most of the people who get GIT infection by Campylobacter, later on they can develop Guillain-Barré syndrome, or for example, acute disseminated encephalomyelitis. It's all like after infection. It is when immunity will start acting against CNS and damages different parts of CNS. So it could be due to that. But mostly when say we talk about CNS infection, so we talk about like bacterial, viral, fungal, and protozoal. So regarding bacterial infections, uh, what kind of infections can be there? Number one, when we talk about bacterial infection, so always think about meningitis. Okay, of course, like in this lecture, we are going to discuss two things: meningitis as well as encephalitis, because and infectious diseases or limology, which in that one, they teach you different infections, and in that one they already teach you meningitis and encephalitis, so you can take it as a revision as well. So meningitis can occur, brain abscess can be formed, okay, as well as uh, syphilis, which is a STI, that one can cause neurosyphilis, or like there could be tuberculosis of of the CNS. So, or like simply mycobacterium tuberculosis can cause this thing. When we talk about the viruses, okay. By the way, like I talk about meningitis. So meningitis can be caused by bacterial infection, and meningitis can be caused by viral infections, right? So meningitis can be caused by bacteria as well as viruses, and then encephalitis. Okay, so practically speaking, encephalitis can also be caused by bacterial infections, right? But mostly meningitis is caused by bacterial as well as viral, but encephalitis most of the time it is caused by viruses, and there is a lot of viruses which can cause encephalitis. So when we are going to discuss encephalitis, then we are going to discuss this thing more. One very important bacterial infection which what you can say, which can affect the CNS, is tetanus, okay, which like you will study in limology or infectious diseases. So encephalitis, meningitis, then there can be rabies, which is spread by uh, dogs, cats, skunks, raccoons, or bats, anyone like this. So uh, other than that, uh, there are some viruses which do affect the CNS. For example, AIDS or HIV virus can affect the CNS. Anyhow, they are more or less like meningitis or encephalitis. Uh, Regarding fungal infections, so there are again many fungal infections which can affect the CNS. For example, um, talking about the fungal infections which can cause is cryptococcal meningitis. Okay, So of course, like it is a meningitis, but it is caused by a fungal infection. It can cause fungus can cause abscess as well. Okay, and in protozoal, malaria can affect the CNS, as well as toxoplasmosis, uh, like especially in HIV patients, or when the immunity is very down, so toxoplasmosis can affect that. So there are many CNS infections, but like our main discussion today will be about meningitis as well as encephalitis. Okay, so first of all, meningitis. So what is meningitis by definition? Meningitis is simply inflammation of the meninges. Okay, inflammation of meninges is called as um, meningitis. So what will be the sign and symptoms? Of course, like if you know what is the function of meninges. But before going into sign and symptoms, I would like to talk about, because whenever we discuss anything, we discuss it under some key points like etiology, for definition, etiology, risk factors, and things like this. So, etiology of meningitis, as I told you, can be many. For example, it could be bacterial, okay, it could be viral, it could be fungal, and it could be others, okay, uh, like spirochetes comes in this one, and syphilis, like here what I put here, a neurosyphilis under bacteria, but basically neurosyphilis is caused by a spirochete, right? So uh, you know when the babies are born, and a good thing, like as I'm also teaching you pediatrics, so I remember when the babies are born that neonate, or 0 to 28 days, or the first 4 weeks of the life, when we call them as neonates, the most common causative organisms are basically, it comes from the mother. So for example, group B streptococcus can cause, E. coli can cause, okay, Listeria monocytogenes is one of the organism which can cause meningitis in extreme of ages, like too young and too olds, okay. So see what's going on, by the way, here. Like 0 to 4 months of weeks of age, okay, or the first 28 days of life, what happens is basically the baby can contract these organisms from when they are passing through the um, birth canal, okay. So group B streptococcus, many of the women, they have this one in their vagina, so that's why they do a swab test and they check like either the mother have group B streptococcus in their vagina or not, okay. E. coli, it is the cause of much of the UTIs. 0 to 4 weeks, okay. So this is 0 to 4 weeks, right? 0 to 4 weeks. Okay, after that, the most common causes of meningitis, remember guys, it's streptococcus pneumonia, right? Streptococcus pneumonia can cause Neisseria, um, menin. Sorry, streptococcus pneumonia can cause Neisseria, meningitis can cause, right? And of course, like Listeria monocytogenes, especially in old people, right? So extreme of ages, remember. Uh, Same like this, for example, Klebsiella, there is a bacteria called as um, Klebsiella. Okay, Ciela. This one, like most of the time, causes pneumonia in alcoholics, right? So it can also cause meningitis. So talking about the viruses, guys, any virus can cause meningitis, but humans, simplex virus, both type 1, type 2, as well as varicella zoster virus, which is the virus for chickenpox, or entero viruses, okay, they all can cause meningitis. West Nile virus can cause, and many more. And fungal infections, remember the same name which I took before. Cryptococcus can cause encephalitis, it can cause meningitis, or coccido coccido coccidoides can cause, right? So this one, these all can cause. And other causes, as I told you, if you will want to put, you can put neuro syphilis right here. And one disease, if you remember, Lyme disease, which is very common in North America, caused by Borrelia burgdorferi, it can also cause meningitis. So these are the causative organisms. Remember these organisms; these are the most important one. Okay, encephalitis is mostly caused by viruses, and remember meningitis is mostly caused by bacteria. So, what are the risk factors for this one? Um, Simply, uh, nowadays, we immunize all the newborns by giving them pneumococcal and meningococcal vaccinations. So anyone who is not vaccinated, for example, if we will talk about risk factors here, what we can remember in this one, like lack of immunization, okay, it can cause meningitis, of course. For like children, most of the children, not most, like I think like most of the children in the world, just few are not, in very underdeveloped countries, they get vaccination against pneumococcal vaccinations. They get vaccination for streptococcus pneumonia. They can get vaccination for H influenza, as well as for Neisseria meningitis. So anyone who's who is not vaccinated, they are at risk of that thing. So this thing, and for example, it could be hematogenous spread from any infection in the nasopharynx, right? So from the nasopharynx, like in the nasal area or in the pharynx area, if there is any infections, they can go to the meninges, and it can cause meningitis. Or any infection in the ear, otitis media, for example, sinusitis, for example. Okay, though not so common, but like they can. Okay, so penetrating head trauma is a very important way, because whenever there is penetrating head trauma, so the meninges are exposed to outside, so the bacteria can directly go to the meninges and can cause infections. Or if there is a CSF leak from due to any fracture base of the skull, it can cause uh, any procedures or neurological procedures. So of course, like iatrogenic causes can be there as well. And of course, all the immuno deficient people, they are at risk, right? So I always talk about immunodeficient people, anyone who is using corticosteroids, chemotherapy, radiotherapy, cancers, too young, too old, or someone who have HIV, all these are uh, immunocompromised people. So all of them, they can get this meningitis, okay? Or if you are uh, in close contact with someone with an infected person, right? So you may can get meningitis. So these are all the causes of meningitis, and with the risk factors, okay? So now, if we will go in this way, that we have to make concepts about what are the how the patients they present, right? So I will show you few things, by the way, in here. Oh, sorry. So I'm going to show you for some photographs, guys, which we use, by the way, to uh, when we examine the patient of meningitis. So uh, what is important here is uh, like the clinical features. Okay, if I will talk about the clinical features, so what's going on, the thing which is going on, like the meninges are inflamed, okay, or there is inflammation, infection of the meninges are there. So as you know, what the meninges are covering, what meninges are covering the brain as well as the spinal cord. Okay, so uh, if you talk about children, basically, children when they have meningitis, children shows, you can say, a different spectrum of signs and symptoms. For example, um, children can present with uh, feeding um, problems, okay, like they quit feeding, as well as they become irritable, as well as they will have fever. Of course, it's an infection. They become lethargic. Okay, so children, they show uh, a different type of sign and symptoms, but the specific sign and symptom which we look for, remember, like, adults or older children even, they present with, of course, fever as the first symptom, and then there could be headache. Okay, the patient presents with headache, as well as and now the meninges are still like inflamed. So remember, neck stiffness is very important, right? So they complain of neck stiffness. They can be confused. Okay, uh, they can be lethargic. uh, they can be they may have altered, you can say, level of uh, consciousness. Okay, so they can show all these things. So now the meninges, one of the things to understand over here, that what is encephalitis and what is meningitis. Meningitis is the inflammation of the meninges, whereas encephalitis is the inflammation of the brain parenchyma itself. Now, like meninges and the brain matter are close together. They are interlinked. They are very much closely placed. So, guys, remember, whenever there is meningitis, and when what I am talking about is the symptoms of meningitis, they may show some of the symptoms of encephalitis as well. Or when the person have encephalitis, they may show the symptoms or signs of meningitis as well. So that's why collectively we call this condition as meningoencephalitis. Okay, because meninges and brain parenchyma, or the brain, is like closely related. Okay, anatomically they are close to each other. So the meninges can inflame or can cause some irritation to the brain, can lead to anything like seizures. Okay, like focal neurological deficits. Okay, so this word, I use a lot, that is focal neurological deficit. Why? Because neurology is so wide, and I explain in neurology lectures, like anything can occur depending on uh, where is the location of the lesion. Okay, so of course focal neurological deficit can be anything from any weakness in any part of the body to any abnormal sensations in any part of the body to any abnormal special sensations as well. Okay, so all of these patients, they present with nausea and vomiting, of course. Okay, and they they have photophobia. They become photophobic, right? So they have photophobia, as well as when when we examine their eyes, we may found papillary edema. Okay, which means, like, the the intracranial pressure is increased, right? Okay, guys, one of the thing when we see now, before going to in a little more detail, I would like to tell you that, when we talk about clinical features, by the way, we ask those things in the history. And see, now meningitis patients, when they present to the hospitals, it's not like this, that all of them, they present with typical bookish symptoms, rather. And this is not important, like they all present in the same way. For example, you may have a meningitis patient in coma. You may have a meningitis patient with fever only. You may have a meningitis patient who is walking and talking with you. You may have a meningitis patient who cannot talk to you. So when we take the history, we ask about, like, for like most of the time, if the patient is conscious, so of course they present with fever. they present with headache, they present with photophobia, they may have present with nausea, vomiting. So now when you will inquire, when you will take the history, then you will take the history of presenting complaints, and then you will talk about, like, you will check for all the risk factors, like if they have any fracture, any recent infection in the nasopharynx, any recent infection in the ears, all these things that you have to cover. Like, you have to dig more and more and refine your differential diagnosis, or uh, think about more and more, like maybe the patient have or have not meningitis, right? So of course, like, we take the history, and like we can found anything among this thing, and then we go for the examination. So in examination, you may have focal neurological signs, and in examination, the specific things which we check is, one of the thing we check is Brudzinski sign, right? So this is one of the thing we check. One of the thing we check is Kernig sign, and one of the thing, like, which we check is uh, jolt accentuation of headache. Okay, and now to tell you what is uh, Brudzinski sign. Now, see, you can see over here. Okay, wait, this one. Sorry. Okay, this one is Brzezinski sign, and this one is Kernig sign. So see, this sign can be simply explained in this way. Um, just a very simple explanation is what, when you will passively flex the neck of the child or even the adult. Of course, in this photograph there is child, but it is not about child, because you can do it like this. You can do it to the adult as well, for example this one, or for example this one, right? So I am showing you on child, but I'm not saying like it is only the child. So on passive flexion of the neck, you will found that the child, or like the patient, will involuntarily flex the hips and the knees. Okay, so see, when the patient is lying flat on the bed, once you are going to passively flex the neck, you'll found like they are going to flex their hip and knee joint. Why? Because all the meninges are inflamed, and when you are going to do that, basically you are going to cause stretch, and due to pain, they flex their hip and knee. So this is called as Brzezinski sign is positive. And what is Kernig sign? Uh, like when you flex the uh, thigh at the hip joint, and then you will try to extend the leg. Okay, so basically there is resistance to this knee extension or the leg extension when the hip is flexed to 90 degree. So see, this one, he flexes knee to the 90 degree. When then he try to straight up his leg, the patient is going to resist that. Okay, why? Because again there is a stretch of the meninges. So this is called as Kernig sign. And the third sign, which is basically the most sensitive one, is uh, jolt accentuation test. Okay, very 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 easy. See, by the way, this one is like I'm using Bing, so they are showing in Chinese, but that's fine, because what they are doing, guys, it's very easy thing. Like, when the patient is sitting next to you, just tell them that, move their head or rotate their head, like this, 2 or 3 times horizontally. So just like ask them to rotate their head 2 or 3 times horizontally, and when they do this thing, that they have headache. Okay, so that is called as headache, or jolt accentuation of headache, or headache accentuated by jolt. Okay, so this is the most sensitive thing. Okay, one thing which I would like to mention here is, guys, very very important thing. um, if you found any patient with uh, petechial rash. Okay, petechial rash. So okay, uh, like whenever you found a petechial rash like this. Okay, petechia. Okay, see, petechial rash. So whenever you found petechial rash in any patient, guys, think about meningococcemia. Okay, meningococcemia. So uh, like this way. Okay, it's a non-blanching rash. Okay, remember, it's a non-blanching rash, and remember, the non-blanching rashes are the most dangerous one, right? So what we do, like, we apply the pressure, and or we can do a glass test. We can put a glass against the skin, and we see, like, either this rash changes its color or not. So if that rash is not changing its color, it means it is non-blanchable rash. So think about, simply straight away think about meningococcemia. Now, why I'm telling you about meningococcemia? Because meningococcemia is emergency. So whenever we found a petechial rash, okay, in meningococcal meningococcal meningitis, think about meningococcemia. It is mostly seen on the lower limbs, right? So, guys, this is an emergency, of course. So what it means, like, if it's an emergency, don't wait for any uh, blood culture reports or CBC report. Simply, uh, what to do in these cases is simply uh, take blood culture. Okay, because if you will give antibiotics, the blood culture results will be changed. So straight away take blood cultures, give the first shot of antibiotic IV, and if you are in GP clinic or in periphery, transfer the patient to the tertiary care unit, because this one can kill the patient. Okay, so this is an emergency, of course, particular rash and meningococcal meningitis. Rest, you understand, guys, like, it's not like this, like the patient will present with bookish symptoms. The patient can present in with any symptom. The patient can present with normal consciousness. The patient can present with altered level of consciousness. The patient can present with coma. The patient can present with head neck stiffness, with fever. So there is a lot of presentation, okay, which we can see in the patients of meningitis. So then we go for investigations. Now think logically, and you would understand what are the investigations. Remember, we are talking about infection. CBC will guide you the best. So in CBC, what we can get, like, either there is any WBCs, like what kind of WBCs are raised. Either it's neutrophils, either they are lymphocytes, like this. So CBC, ESR, CRP, of course, like, very important investigation. Then always take the bloods for culture and sensitivity. Okay, why? Because we have to uh, see what kind of meningitis it is there. Because, like, they do the gram staining, and tell you either it's gram positive or negative. Then they see the shape, either it's a diplococci, either it's a um, like lactobacilli and all these things. So simply they will tell you the organism what is there. We can check the CSF. We can take a sample of CSF, right? And of course, like, whenever we take the sample of CSF, basically we divide it into 5 different samples. And what are the investigations we can run on that CSF is simply, we can check the cell count. Okay, for example, if the cell count is showing too much WBCs, and the WBCs are more than 500 to 1000, 10,000 per liter, it is bacterial infection. But if the WBCs are like between 10 to 500, it is viral. Um, Check what is the cell type. For example, if it is neutrophils, it is bacterial infection. For example, if it is lymphocytes, it is viral infection. We can also check the glucose level of CSF. Like, glucose is decreased in bacterial infection and normal in viral infection. We can also check the protein content of the CSF. Like, the proteins are markedly increased in bacterial infection, and they are mildly increased in viral infections. Okay, we can do the gram staining of the CSF as well as we can do culture and sensitivity. Okay, so these five things are very, very, very important. And of course, like they can check, they can take a look of the CSF, how it looks like. Either it's clear, either it's opaque, or it's cloudy type of thing, right? So very, very, very important thing. If the patient is immunocompromised, so uh, then of course, like think about compromise, then you can think about other conditions, like it could be fungal infection, it could be a TB. Okay, then we go for these investigations, like we can do cryptococcal antigens or stuff like this, or acid fast bacillus staining or Zeal Nielsen staining to catch the tuberculosis. You can do a PCR to check for different viruses like herpes simplex virus, VZV. Of course, we don't go for all the investigations, but when we discussing the topic, so we have to discuss all the investigations. So we can do all these investigations, of course, right? Rest, like we can do for CT, we can do for MRI, we can go for EEG, for example, if the patient is having any focal neurological signs, or if the patient have seizures. So of course, like EEG is going to help a lot. Okay, so uh, how we treat the patient. Okay, treatment. Remember, uh, it's bacterial meningitis is a medical emergency, and remember, do not delay antibiotics, right? This is very important point, guys. Remember this thing. So we don't delay antibiotics for anything, like you cannot delay antibiotics for, like, you want to take lumbar puncture. You cannot delay antibiotic like you are waiting for a CT scan. Rather, we just take the blood samples and we start the empiric therapy, right? So what is empiric therapy? I explained you guys before that empiric therapy is simply what we give, like from the previous knowledge or the most common organism we know, we give that one. So one of the thing, if it's a child or a neonate, okay, so the most common organism is group B streptococcus or E. coli. So the best one of the combination we can give to them is ampicillin neonates, right? So one of the things we can give is ampicillin, right? Which is for gram positive ones, and we can give them cefotaxime, which is the third generation cephalosporin. Okay, it's not important like you can give this combination. Rather, you can give any other combination. You can give ampicillin with gentacin. Okay, and of course we give these drugs IV. For example, if it's a adult, like, or a old child, so you can give, for example, vancomycin. Okay, vancomycin we can give, or if you're suspecting what you can say, Listeria monocytic genes, add ampicillin, right? Ampicillin if suspecting Listeria. Okay, monocytogenes. If you're suspecting Listeria monocytogenes, go for that. Okay, or you can add this ampicillin for anyone. For example, if the patient is immunocompromised or if the patient is using alcohol. So this is like we don't delay the treatment. We don't delay for the treatment, and we like waiting for the lumbar puncture or all this stuff. So very, very, very important point. Okay, so of course, I'm just telling you the names of antibiotics, but of course, this is not the only treatment, because there is fever. You have to give antipyretic drugs and all these things. Of course, like other measures are taken, but uh, antibiotic is the treatment if there is bacterial meningitis, right? But of course, if there is viral meningitis, we don't give any antibiotics. Rather, we go for uh, supportive therapy, right? Antipyretics and all this stuff. So, guys, this is all about meningitis and uh, how we can protect the patients from meningitis. We can protect the patients by giving immunizations, right? So immunizations are available nowadays against Haemophilus influenza B, uh, against Streptococcus pneumonia, against Neisseria meningitis, okay? And children can take, adults can take, okay? But most of the time, like when it comes to the adults, only the high risk group take, okay? It comes by different company names, like Previnar is the one, very, very, very famous one. Nemovax is one of the vaccination. So this thing is important. A prophylaxis treatment can be given to any close contact. Okay, anyone who come in close contact, who who come in close contact with anyone who have meningitis, we can give them prophylaxis. Okay, for example, uh, we give prophylaxis to anyone, to the babies or anyone who is immunocompromised. So ciprofloxacin can be given, rifampin can be given, ceftriaxone can be given, um, to all the households or the people who are in close contact with the patient who is having meningitis. Okay, so all these medications can be given. So this is how we treat meningitis. This is how we diagnose meningitis. And the prognosis, like there is like there can be complications like seizures, cerebral edema can be there, SIADH, which is syndrome of inappropriate secretion of antidiuretic hormone, can be there. Okay, deafness can occur in children, even in bigger people. Death can occur, and the mortality is high whenever it is caused by Streptococcus pneumonia. Up to 25% patients, they die because of meningitis, like when they have streptococcus pneumonia meningitis. And most of the deaths, of course, is like in too old or too young patients, whereas like many of the people, they recover as well. So this is about meningitis. Second thing I told you is encephalitis. Okay, so as you know, like what is encephalitis? Encephalitis is basically infection of the meninges. Okay, uh, okay. So what how to start with is what we do is simply. Oh, sorry. I must write the definition. Okay, so it's inflammation of brain parenchyma. Okay, parenchyma. So inflammation of the brain parenchyma is called as encephalitis. And as I told you already, that uh, what you can say, meninges and the brain parenchyma are in close relationship. So it's not like this. What I will be talking about encephalitis, like all the patients who have encephalitis, they will be having just the features or symptoms of encephalitis. Rather, there is a considerable overlap in the silent symptoms, and that's why we collectively call both this condition as meningo encephalitis. Okay, encephalitis. So that's why it is called as meningoencephalitis. Okay, because the features they overlap. So etiology of this one, as I told you before, like viruses or the viral causes are the most common one, right? It could be bacterial, guys. It could be parasites. It could be fungal, of course. It could be post-infectious, like I told you. Yeah, post-infectious. It could be. It could be auto antibody mediated um, encephalitis. Okay, encephalitis. So antibody mediated encephalitis is also called as uh, AEDM. Sorry, no. Sorry. But AEDM is basically acute disseminated uh, encephalomyelitis, which is like post-infectious. Okay, acute um, disseminated encephalomyelitis, ADEM. So viruses, if I will talk about viruses, see, any type of viruses can cause encephalitis, but again, actually, I memorized the name of the viruses, and one day, even like you will, like when you would know like what is the game of the viruses, it will become very easy, guys. Herpes simplex virus can cause, varicella zoster virus can cause, Epstein-Barr virus can cause, cytomegalovirus can cause, HIV virus can cause, enteroviruses can cause, West Nile virus can cause, arbovirus can cause, influenza can cause, HIV can cause. Measles, mumps, rubella can cause, polio can cause. Now, why I'm taking the names of all the viruses, but remember, almost all uh, all the viruses can cause. Why I'm saying this thing, because remember, viruses as a complication can cause itis of any structure of the body. Think about the structure the viruses can cause. For example, mumps can cause orchitis, which is the inflammation of the testes. Viruses can cause conjunctivitis, can cause encephalitis, meningitis, pancreatitis, hepatitis, nephritis, okay, enteritis, pneumonitis. So viruses can cause any itis in the body, even dermatitis. So that's why I am taking the names of all. And when it's come to the bacteria, again, it could be caused by Listeria monocytogenes. It could be caused by mycobacteria. Could be caused by syphilis, for example. Parasites, uh, toxoplasmosis, okay, in immunocompromised people, right? Fungal, remember the name of Cryptococcus, uh, and what you can say, coccidioides, right? It can cause. So, uh, like there are different etiologies. Like these are all the etiologies for uh, encephalitis, right? Now, the important thing over here, basically, what is encephalitis? What happens is the patients they have inflammation of the brain, okay, and uh, when there is inflammation of the brain, uh, the brain becomes swollen. There is swelling in the brain, and there is edema in the brain. The viruses, they can reach the CNS by the help of peripheral nerves. For example, if you know what is rabies, like in rabies or in tetanus, tetanus is a bacteria, but both rabies and tetanus, the bacteria or the virus, it go through the axonal transport. Like there is a retrograde transport. Like you can say they go into the nerves, and then they started climbing up to the brain, and once they reach the brain, they started causing inflammation. So that's what going on in these one as well. So like the viruses, when they reach, of course they can cause this thing. Okay, guys, one of the thing which you have to like, which is very important in encephalitis, is basically herpes simplex virus encephalitis. Like in China, there is a, not in China only, but like the east coast of China or in Japan, there is Japanese encephalitis, which is spread by the mosquito bites. Okay, so there is like West Nile encephalitis. There is uh, uh, many types of encephalitis depending on what is causing that encephalitis. But herpes simplex encephalitis is very important to mention here. Herpes simplex encephalitis. Okay, why this one is important? Because it causes acute necrotizing necrotizing you can say hemorrhagic, okay, hemorrhage or hemorrhagic destruction of the brain, simply you can say. So it causes acute necrotizing hemorrhagic, uh, like the brain tissue is destroyed by this virus. Okay, so like what happens is basically there is lymphocytes which started collecting at that area. Okay, and this one hemorrhage. Okay, this herpes simplex virus most commonly involve the medial temporal and inferior frontal lobe. Okay, so this is the most common area where this thing occur, and many of the times it is asymmetrical. Okay, so it doesn't affect like both of the sides, rather it is asymmetrical. Okay, so this is herpes simplex encephalitis. I will tell you why I am like explaining with this thing as a different thing. So all these things, all the viruses can cause, even this COVID-19, by the way, which is causing pneumonia all over the world. It can also cause myocarditis. It can also cause encephalitis. So it, like, because it's a virus, so viruses can cause anything. So this thing. Um, Now the clinical features. Okay. Again, how the patient will present. And now, if now what is the thing is that in this one, the brain parenchyma is affected. But remember, meninges and encephalitis, uh, sometimes it's hard to distinguish the patients uh, based on their functionality or based on their cerebral functions, because the cerebral functions are abnormal in encephalitis patients. They have altered mental status, they have motor or sensory manifestations or deficits. Uh, their behavior can be changed depending on which area of the brain is involved. They have movement disorder, they may have speech abnormalities. But these things are not too much present in meningitis, okay? But still, there is a lot of overlap, because there will be a little neck stiffness, okay? And meningitis, there will be some of the clinical features of the CNS involvement, okay? So simply, now, as we know that it's an infection, right, or it's an inflammation, so the patient will present with fever, the patient will present with chills, the patient can present with malaise, okay, the patient can present with nausea and vomiting. So any of these things are there. So if the patient meninges are also involved, then think about headache, think about neck stiffness, okay, think about what you can say, uh, photophobia, okay, think about Kernick sign, think about Brzezinski sign, think about head shoulder accentuation of the headache, right? But because, okay, in that case, of course, it will be called as meningo encephalitis, right? It will be called as meningo encephalitis, right? In that case, okay, so this one will be there. So now, think about the brain parenchyma. Now, guys, it's very hard to talk about all the functionality of the brain, or what will happen if the occipital lobe will be affected, what will happen when the parietal lobe, left one, right one, temporal lobe, left one, right one, or the frontal lobe, left one, right one. Of course, it's very hard to say, but what can happen? The patient can generally, whenever there's inflammation in the brain, the patient can present with seizures. Okay, seizures are very important in this one. The patient can present with um, uh, what you can say, altered level of consciousness, right? So altered level of consciousness, right? Ness can be there, right? So the patient can present, or the patient can present with focal neurological deficits. Okay. Now these deficits can be anything. Okay. Of course, hard to say. But the clinical features of herpes simplex virus encephalitis, or herpes simplex um, encephalitis, okay, like, of course, right, we can talk about that. Why? Because this one is the one which affect the temporal lobe or the inferior part of the frontal lobe. So that's why. And it's an acute condition, acute necrotizing type of hemorrhagic type of condition. What happened in this one? Why it is called as acute? Because the symptoms develop uh, in less than a week. Less than a week, right? So it is like acute type of condition, and the patient present with focal signs, okay, or the focal neurological signs. What are there? The patient can present with hemiparesis, okay. They have weakness in half of the body part. They may have movement disorder like ataxia. They may have aphasia. They cannot speak, or they may have seizures. Okay, but when the temporal lobe is involved, remember they have behavior problems, right? Their behavior change completely. Their personality change completely. Okay, so behavior disturbances are there. in the patients who have this temporal lobe involvement. Okay, so behavioral disturbances in temporal lobe involvement. So this is a very important point, guys. Temporal lobe involvement gave behavioral problems. So now basically, it's what's the definition? It's acute inflammatory necrotizing hemorrhagic, which is progressive condition, and it's highly dangerous or bad. It's rapidly uh, progressive condition, okay, and uh, which can lead to death or coma or death, by the way, a coma or death, okay, within days, okay, coma or death within days or within weeks. So it goes very fast, okay. So this thing is like what you can say are the features of herpes simplex encephalitis. So now, if we will talk about the investigations of the patients who have encephalitis, again now investigations, uh, simple things, we can do CPC, we can do ESR or CRP in this one, of course, but we can do lumbar puncture, we can take the CSF, and we can again run the same investigations, like we can do a cell count, okay. We can see the fluid, either it's how it looks like, we can check the glucose levels, we can check the protein levels, we can do culture and sensitivity, right. We can do this one, right. Or what is the most common cause of encephalitis viruses? We can run PCR on this one, CSF, simply to check what is the causative organism, right. We can do serology, because serology will help us in identifying or will help us in diagnosing what kind of encephalitis is there. For example, either it's virus or what kind of virus is there. So we can do this thing. We can do a CT, which can guide us, like either there is any increase in intracranial pressure. We can do MRI, and we can go for EEG. Okay. Now, remember this thing. For example, brain tissue biopsy. Okay. Brain tissue biopsy is very, very, very invasive procedure, and it's related to brain. So of course, we most of the time, this invasive type of testing is not done. But if it is required, for example, if the investigations, like if the diagnosis is not clear, like either it's encephalitis or not, or what kind of encephalitis is there, then we can do brain tissue biopsy. But remember, it's highly, highly, highly invasive, invasive, right? So this thing. So for example, if you are doing CT scan and you are finding that the patient have um, medial temporal, for example, medial temporal necrosis, right? So what it is? Remember, think about herpes simplex encephalitis, or it's like, of course, like same thing on MRI you can see. So this thing, of course, we can do all these investigations for the patients. The last thing is, of course, like the treatment. Okay, so now to tell you, like, what is the most common organism which can cause encephalitis, guys? It's viruses. So treatment is supportive. Okay, supportive treatment is there. What is supportive treatment? If they have fever, give them antipyretics. Take care of their hydration. Keep on doing EEG. If they're developing any seizures, we can give them anti-epileptic medications. Okay, monitor their vital signs and all this stuff. In herpes simplex virus encephalitis, what we can give them to the patient, because it's an aggressive type of condition, we can give them IV acyclovir, which is antiviral drug. So of course, like, this is the drug which is given empirically if you suspect bacterial encephalitis. So of course, start the patient. antibiotics. But of course, like the outcome and the mortality is very, very, very much high. So this is how what you can say the patients of epilepsy, or sorry, not epilepsy, uh, encephalitis are treated. Okay, so remember, guys, like I told you, uh, it's not like this. Like every patient present with the same signs and symptoms. Rather, there is a big range of presentation. So always take good history. Uh, if the patient is coming in emergency and is have to like is uh, not conscious, then of course we cannot take history. We will go through the ABC approach. Okay, so or we can take like a parallel history from the people who bring or the close contacts, of course. So this can be done. So thank you for listening, guys, to this lecture, and I hope you understand this condition.